Welcome, everyone. Really pleased to have you join this first in a series of system change webinars, which are there to share the learning from the Golden Key programme as we're about to wrap up, since we're coming to the end of our funding. So a few bits of housekeeping. First, you're welcome to introduce yourself in the chat box. There are no slides, I believe, during this webinar, but the session is being recorded and will be shared with all of you afterwards. It will also be published on our YouTube channel and our website, should you wish to share it with your colleagues. There will be an opportunity to ask questions after all the panelists have spoken. So please put your questions in the Q&A box, which you should be able to see at the bottom of your screen, kind of towards the left. So yes, feel free to put your questions in there throughout the session. And towards the end, we'll just relay them to our panelists. So a little bit about Golden Key, if you don't know what Golden Key is. So Golden Key is a partnership between statutory services, commissioners, the voluntary sector, and people with lived experience across Bristol. And we work together to improve services for Bristol citizens with the most complex needs. We are an 8-year funded project by the National Lottery Community Fund. We are very much at the end of these 8 years. So we are currently working very hard to share and disseminate the learning that we've accumulated these past 8 years. So as I said, this is the first in a series of system change webinars. We'll try and give you different perspectives, and we hope that you can come to more than just this one, because they all add to a wider picture, if you see what I mean. We hope as well that these webinars will help you learn how you can apply some of what we've developed, created, discovered in your own context. Today, we're going to be talking about 5 main system challenges that we've observed in our work with people experiencing multiple disadvantage. And we'll hear from different perspectives, from people on the ground, like Tabby, to people at a more strategic level, like Aileen, who you'll notice is not on the panel yet, but will be joining us in about 20 minutes. Tom, who's also on the panel today, was the team lead for the service coordinator team at Golden Key. And I will give him the opportunity to kick off the webinar.
Okay. Thank you very much. Hello, everyone. Welcome to our first webinar of our series. So I'm going to introduce the 5 systemic challenges this morning, and then pass over to a couple of my colleagues who will be able to share some examples around what we mean by them. So to give you some context and a bit of a background to how they emerged in our work. Golden Key was an 8-year project. I was actually a team lead for 4.5 years of that. And we were kind of really briefed to really understand the system and to really look at the blocks and barriers that people with multiple disadvantages were facing. So at the beginning, we took a classic kind of approach, really, which was quite a sort of linear and diagnostic approach to understanding the system and what the blocks and barriers were. We had a team of 10 coordinators, each with a caseload of around 10 to 15 people, all experiencing the cyclical experience of the system. And we went about just recording these blocks, and we ended up with over 600 blocks, and we just had lists and lists and lists and lists and lists. and we didn't really know what to do with it. There was so much data, and obviously we started to theme them, and we started. What started to happen is that there were sort of emerging patterns and repetition and what have you, and we thought, well, this is working in terms of a kind of quite a deficit way of doing things. So we're naming the problem and we're understanding all of what's happening in the system with people, but it's not really helping us achieve the change that we were hoping to achieve. So some of the things that we're experiencing, things that you would probably be more than aware of. Non-engagement was a big term. So why are people not engaging? Well, is it the people not engaging, or is it the system not engaging with individuals? Inappropriate options was a kind of theme. So that's one of the systemic challenges, and just recognizing that the system didn't really provide appropriate options for people facing multiple disadvantage. In particular, good examples around housing and care provision. There are challenges there, but we also found that those services who were working with those multiple disadvantage were striving and to do the best, and we would observe these amazing things happening, but the system flex, we would call it, there was no way of kind of recording that. So the system doesn't kind of lend itself to really capturing that learning and embedding that. So that kind of led on to people, really the people working with often were in transitions. So that's cyclical behavior, which is the second one. So people coming out of hospital, whether that's mental health hospital or general hospital, people coming in and out of prison, so the prison recall cycle, and then the eviction cycle. Often people are being evicted and then just going round and round the pathways. We noticed that seemed to be a good theme and a good window of opportunity, really, where really we could affect change. Another thing that we're able to observe is around assessments and thresholds. So we're all aware of the term dual diagnosis. This was a major issue. The issue with capacity, so Mental Capacity Act assessments, mental health assessments, and the fluctuation of that, which is linked to dual diagnosis. Also safeguarding referrals, and how often we would have to kind of repeat the referrals, and it was quite hard to kind of ensure people's safety around that, and just continuously filling out assessments. How difficult that was to engage for people, repeating their stories and what have you. Then that sort of leads on to this idea of accountability, and this idea in the system where it's the system really, as most of us are aware, we work quite in a siloed way. So there was a sort of lack of shared accountability, shared responsibility for clients, and there's lots of passing the buck, or this person, they've had their time, so therefore it's over to you to, they're being passed around the system. So this idea of shared risk, shared accountability, working together. And then a really big thing with that is keeping people safe, and domestic violence, women's experience of the system, and people with protected characteristics seem to be quite an issue as well. So through that experience, through all those issues and that experience, we really came up with this tool, this model, which we're presenting today. And at this point, I just wanted to kind of share the video which we've made. So this is going to be accessible on our website, which tells you a bit more about the model. And then I'll just conclude with that after the video. Thanks, SJ.
At Golden Key, we have spent 7 years learning about the challenges people with multiple disadvantage can face when they are trying to get help. Support systems can struggle to work in a joined-up way if someone has several types of need. We've noticed that the same types of challenges often occur in different parts of the system, and we want everyone who works in it to understand what they are. If everyone committed to taking small actions to address these big system challenges, it could create significant change. So, what are these problems? Here's a brief overview of each system challenge. Firstly, there are not enough appropriate options available for people who have multiple and complex needs. Workers are great at bending the rules and getting good outcomes for individual cases, but the learning from these successes is often lost. Secondly, accessing services and understanding different criteria, referral, and assessment processes can get very complicated, and people sometimes find that explaining their situation is so upsetting they'd rather not keep putting themselves through it. Sometimes it can be challenging for services to support people at the right time and when they most need it. Periods of change and transition are difficult, and people experiencing multiple disadvantages often need extra support at these times. Communication and information sharing often breaks down during transitions, and this can cause people to end up back in more difficult circumstances. More shared accountability is important. Sometimes when things go wrong, everyone looks for someone or something to blame. A rule, a system, a person, or an organisation. This can block learning and keep people focused on the problems. Collaborative work is most effective when there is a culture of shared accountability and trust between organisations. And lastly, culture and mindset. People with multiple disadvantage have often experienced trauma, loss, and adversity throughout their lives. It is important for us all to remember that no one chooses to experience these types of issues. They develop as a result of things happening that are outside of an individual's control. We need to develop a culture where no one is viewed as unhelpable. For more details about these complex system challenges and further ideas about what you can do, please visit our website.
Great. So there we go. We've got the 5 systemic challenges. It's a framework. It's a model to really help the system make sense of this complexity. People experiencing multiple disadvantage, and what we realized is that instead of just listing the problems, which we all do quite well, maybe we can create a framework and some focus on the complexity. So this isn't a solution to the challenges, but it's an offer in our evidence. And all this time we spent working with multiple disadvantage, if we were to focus on these areas within the system, within our own context, then it could help enable change. This is very much our experience within Bristol, but working nationally with Fulfilling Lives, it also resonates with their areas as well, localities as well, that these are good themes for us or anyone to take and really try and focus. So if you're trying to affect change and improve your service or improve people's lives, and these are helpful to do that. So I think it's useful to be able to sort of move away from that problem solving approach, and then try and use this as a focused area. So if you're to open up these reflections around how you experience these themes in your system, then it lends itself to really helping move forward. But they don't encompass everything. But we just found that these are kind of areas that were really useful. So when we're talking in a team, or I might be talking in supervision, if we're stuck with a client and what have you, it's quite helpful to just really think about these areas and to move forward. I think the last one, mindset and culture, is really, really important, and that's a really good place to start. And really sort of questioning where you are, where your team is, and where your organization is in terms of their mindset and culture, in terms of working with multiple disadvantage, trying to kind of build more partnership working and collaboration and what have you. We're going to hear from Tabby about some actual kind of live work and how her work sort of linked with these areas, and we will hear from a strategic perspective as well. So I think I'll leave it for there, and then I'll be able to open up any questions later regarding that. If that's okay.
Yeah, do you want to take it from there, Tabby? So Tabby is a service coordinator for Golden Key and also now moving to the Changing Futures program, which kind of follows in the footsteps of Golden Key a little. But yeah, so Tabby has been working quite closely with clients, and she'll be able to explain a bit more how the 5 system challenges worked for her.
Thanks, SJ and Tom. Good morning, everyone. Hello. So I'm going to be talking about my experience as working as a service coordinator for Golden Key, and particularly working with vulnerable women, which is the sort of specialism that is kind of my area. And really the systemic challenges being faced by one of my clients at the time, there was the catalyst for that was that there was not enough appropriate housing for that person, particularly because it was someone who experienced severe multiple disadvantage when accessing services, and because she required a gender-informed and trauma-informed service. Now, I know everyone here will know and have more than likely experienced very similar systemic challenges when working with people with high level of needs, which is why I wanted to speak about how these kind of played out for this client, and how we sort of worked through that. And so when I started working with this person, she was living in a specialist housing placement. However, the intersection of her needs around mental health, drug and alcohol use, high level of antisocial behaviour, and a vulnerability to exploitation and violence meant that it became increasingly challenging for the housing provider to continue to manage their support needs. And so what we sort of observed with this person, despite being in specialist placement, became too complex for complex needs. And unfortunately, they were issued with a notice to quit. And we knew already that there was a lack of appropriate options for this person because it was a challenge already to find that placement that they were in. And so that really became the catalyst in this case to all the systemic issues that then sort of ensued and this client faced. And at the time, adult social care were involved, and they were tasked with being able to find new accommodation for this person. But as we knew, the options were severely scarce. And the brokerage team initially couldn't find any providers in Bristol that were prepared to offer this client support. And so they began looking out of area, which in addition to being faced with eviction, was not what the client wanted. And they became increasingly distressed by the suggestion. And so the impending transition and the level of instability that they were experiencing meant that everything for them in their world was escalating. The situation for the client became quite unsafe at times, and there was a lot of risk surrounding some of the behaviours that were going on at that time, and lots of safeguarding issues as well, that as a sort of multi-agency team around that client were working to support and keep that person safe. They also disengaged really with a lot of the support because they essentially felt that they were unhelpable because, you know, we couldn't find a place for them, and they knew that they needed to leave, which also just made things more and more challenging really for the specialist housing provider that were holding on to them until, you know, in the interim, until that alternative accommodation was essentially being explored. And so during that time, I continued to offer my support to the client and remain that consistent person who, you know, just regularly trying to engage with them. I also increased my support to the housing provider and that team, that staff team, who were finding it really quite difficult to sort of manage the accommodation side of things to support this person. And we did that by regularly communicating and sharing with the multi-agency team. So I was sort of speaking to them on a daily basis and just checking in. We'd share that sort of to the wider multi-agency team. I think it was really crucial as well that in our regular sort of safeguarding meetings and the multi-agency meetings that we were having, that they remained strengths-based, and we use a strengths-based agenda as well each time because there were so many challenges. It was really helpful for us not to continuously only focus on all the problems that were kind of being faced, which were real, and we didn't want to minimize them at all, but it just allowed us a little bit of sort of headspace to really think and understand what was going on for this client, and particularly sort of understand what systemic challenges were being faced at that time as well, which also I think really helped to ensure that we were working collaboratively, and that, you know, each individual agency wasn't kind of reverting back to the siloed and rigid way of working, which we can all often do when we're facing lots of challenges. So yeah, I think this also just really helped to share a lot of risk and accountability among professionals, and maintain a lot of those relationships between us as professionals, but also with the client as well, so that we could continue to function well as a team around them, despite there being lots of difficulties as well. And we didn't really feel, we could really empathise with the client, because we didn't feel that an out of area placement would be suitable for that person. It would cut them off from all their support. But we also knew that the housing pathway wasn't suitable for them either, because of their multiple and complex needs, and potentially could have increased the risk to them as well. So the professionals at this time, it also felt really, really challenging, because we just didn't have an answer, and we just didn't see a solution either. And so it really did heighten a lot of sort of concern and uncertainty around the client's accommodation situation. And yeah, I think all of us together, and my role was really to just bring all the professionals together, facilitate those spaces, for us really to reflect on that and offer each other support, despite us not having the answer at the time. We also thought to make a referral to the Creative Solutions Board, and that's really an operational sort of meeting for strategic leaders to come together with the aim of thinking differently about longer term solutions for people who experience lots of multiple disadvantages. And this really meant that we were able to bring in lots of different perspectives and kind of share that at a strategic level, and actually ask for input from across the sector. And it meant actually that we increased the accountability and enabled some of those ideas to kind of really come through. And it was really creative, actually. Like, lots of innovative ideas came out, and lots of good practice around dual diagnosis also came out. But after a few months, I guess, of brokerage looking for alternative accommodation and there not being any suitable options, what we saw was a Bristol-based specialist housing support provider come forward and offer support to this person. And at the time, this felt like a miracle. And it emerged that actually the manager there had worked with this client before. They were aware of the high level of needs that this person had. They were committed to trauma-informed working, and they ran a gender-informed service. So it just felt phenomenal that they were prepared to offer support at this time. And what was phenomenal about that story was actually that they began then creating capacity within their own team to ensure that they were in a position to offer the support that this person really needed. So they started actually taking on a new role, and became very involved in actually understanding exactly what needed to be put in place for that person. And interestingly, that new placement required more hours than this person had been assessed as needing under the Care Act. So the social worker came in, worked flexibly to try and meet with this person, despite them sort of not wanting to engage, but was able to do a Care Act assessment over a few different sessions, and found them eligible with sort of bumping up their hours a little bit, only like 1 or 2 hours. But it just meant that then this person, we were able to contain the instability around that transition and offer them a really good service, actually, from the new housing provider. So I think that this case really was an example of where the inappropriate options was the catalyst for that, the systemic challenges that were being faced for people who might experience multiple disadvantages, and the clients then facing many more further challenges, but that as a multi-agency team and working in a strengths-based way, we were actually able to sort of work through that and hold all that complexity to then actually be able to be in a position where this person remained safe and transitioned from their old accommodation to where they were living now. So yeah, that was our experience.
Thank you, Tabby. That was really interesting.
Mm-hmm.
We've got a good question that's come through from Joanna, and we will answer it, Joanna, at the end when everyone is spoken. So I wanted to introduce Aileen, who's just joined us. Aileen is the CEO of Second Step, and Second Step also happens to be Golden Key's lead agency. So as I explained, we're a partnership, but Second Step was the lead agency as part of that. So Aileen, do you want to tell us a bit about the 5 systemic challenges from your point of view as the CEO of a non-profit organisation?
Yeah, thanks, and hello everybody, and thanks to Jane. Yeah, and thank you so much to Tom and Tabby for giving the kind of context and experience that led us to identify these 5 systemic challenges for people with multiple disadvantage. You know, as we've said, these issues you're going to be very likely to be very familiar to you, and as Tabby's rightly said, you know, they impact on the lives of people with people with multiple disadvantage and mean that they receive poor or no services at all. And as Tabby was saying then, you know, what we all see are agencies that are focused on their service delivery, but often become very inward focused, both operationally, but also strategically. And, you know, when things are tough, you know, we can retreat into our kind of silos, especially when we're under pressure. And especially when demand, you know, is very high, you know, agencies can kind of enter a kind of siege mentality, and it becomes, you know, very hard then to operate in that kind of system space. And I think that's really important to think about. You know, we're all used to working in our organisations. We're used to working in partnership, but to work in a systemic way requires us to operate differently and to be in that space outside of our organisation, linking back into organisation, to have a different kind of view. But you know, what we don't want to do is just admire the challenges. It's very easy, and you can see this happening in places. You know, people can talk about problems a lot, and we can just end up what they call admiring the challenges without doing anything about them. And you know, somebody on our Golden Key Partnership Board, someone from the CCG, the Clinical Commissioning Group, said that in the NHS they recognise that happens a lot, that admiring the problem is something that happens a lot. And I think just noticing when that happens, when you're admiring the problem and not doing anything about it, that can be sometimes a comfortable place. But actually, what we want to do is actually tackle those issues. So what I want to talk about a little today is about how we work at a system and strategic level to reduce the impact of these challenges, and to improve people's lives, because that's what it's all about. You know, and what Tabby described there, you know, with the Creative Solutions Board, with that individual, was, you know, staff work really hard to find individual solutions, which is absolutely fantastic and great news for that person that Tabby was working with. You know, and what we want to be able to do is use the examples of System Flex to bring about system change. So moving from the micro to the macro solutions, recognizing that complex problems require complex approaches to resolve them. If they were easy, we would have done them. One of the most important things that we can do collectively is to help the system to see itself. And that's hearing from all players or partners in the system, and importantly, to hear from people with lived experience. We're then moving from the subjective, so what it feels like for me as a staff member, what it feels like for my agency, to an objective view of the system, to take a whole system picture. And what people say is, being able to have that whole system view is really one of the most important things that we can do. So often this can be referred to as taking a balcony view or system mapping. And actually, when you do that, as a system starts to do that, it helps us to make different connections, have better understanding of the issues, and importantly, to see new possible solutions. And importantly, it's so what it does is that we start to gain better understanding of other people's lenses, other people's pressure points and priorities, and you can then think collectively about where are the aligned strategy, where is the aligned work, how can we work better together, and how can we influence people's priorities. So finding that place of shared system goals is really important, and translating them to people's priorities will help gain buy-in. Getting data and also personal stories will really underline the costs of the system. Excuse me. Getting data and also personal stories will underline the costs of the system and to their organisation of system failure. For example, with the new integrated care systems, the transformation that's going on at the moment in terms of health and social care, what we know is there's going to be a really big focus on integrated care. So this is really going to support the work on transitions, thresholds, and assessment processes. Importantly, what we have done is support the voice of lived experience. This is so important. And actually what we know, that voice of lived experience can really greatly enhance system change. Golden Key in 2019 worked with our local clinical commissioning group when they were writing their mental health strategy. What we did was with their engagement teams is to do some work around hearing. We facilitated really hearing from people using the Golden Key services about what their experiences were, as Tammy very eloquently described the kind of issues that are going on for people. So from those workshops of really sharing those lived experiences with agencies, the concept of My Team Around Me was born. And this is building on the multiple disciplinary team approach, but it's much more than that. And it's really about agencies pivoting to a different way of working. So really wrapping around and providing that long-term support to the individual, and not stepping back or discharging people when people are struggling to engage. And we are going to be piloting that approach in our Bristol Changing Futures programme. And what we're really hopeful about is that My Team Around Me work will really help key agencies to come together to resolve some of those 5 systemic issues. And the 5th systemic issue was around culture and mindset. And we absolutely understand that getting the right culture and mindset really will make a big, big change. So it's from competition to collaboration. It's from a system that blames and points fingers to one that actually understands and begins to have a trusting environment. So from that culture and mindset, you then create the conditions of possibility. And in that place of culture and mindset, relationships are absolutely key to this. So what we have learned through Golden Key is reaching out and building those relationships with those strategic leaders is absolutely critical to actually making those big changes happen. We know that the partnership work that we've done in Golden Key really has enabled so much fantastic work to happen, but also was the bedrock of Bristol being successful with its Changing Futures programme. So for us in Bristol, it's getting the right partnership structures right. Who should be on the partnership board, and Tabby referenced the Creative Solutions Board. Fantastic that we set that up. I think it was towards the end of 2018, where we're bringing strategic people with holding the purse strings, but also operational leads, so that they can actually change the offer to individuals. But also importantly, reaching into other boards like the Resolve board or the Clinical Commissioning Group boards. And it's really important that on those partnership structures that you have people who are going to provide leadership and vision and to set the right goals and direction for the programme, and to be accountable for their organisations' engagements in the partnership. And also what's important is language. Getting that language right is so important. I'll just give you an example for some work that we've been doing in Somerset around mental health transformation. And one of the key leaders in the Somerset Foundation Trust said that working together on language has been the major thing that's driven change in the mental health trust to facilitate the change that they wanted, the culture change that they wanted to bring in. So, for example, one of the things that we are promoting in the Bristol area is, instead of talking about shared risk management, talking about shared safety planning. And safety planning is a strengths-based mindset. So we're talking about a strengths-based approach, as Tabby was talking about. And it's a mindset change from a deficit about the issues to actually let's look at the strengths. And obviously it is about safety, it's about stability for the individual and for the staff groups, but actually that kind of language change, it can really help facilitate the kind of shift that you want to make. And you know, when you look at some of the system change work that needs, they say the really, you know, the bottom end of the iceberg is that mentality. So the deep bit, the bit that you don't see of the iceberg, is that culture and mindset, that bit. So one of the things that we are committed to working with the health and care sector through the Changing Futures programme and Golden Key is to do that shared safety planning work, which is obviously shared accountability as one of the systemic challenges. And finally, just to kind of wrap up, you know, for us, it's also about modelling good system behaviours. And actually, we don't need to wait for someone else to do this. It's for us individually to do this. So I'm sure that Tom's going to talk about this in the minutes, but being curious, actually being kind to ourselves and being kind to other people, you know, asking, you know, questions, but not making judgments, acting with humility, and also acting in a way that builds trust with our partner agencies and with the system as a whole is the way that we're really going to shift these issues and make the biggest change for, you know, the people that really need their outcomes to improve. So thank you very much. Thank you.
Thank you, Eileen. That was really interesting. Thank you to all of you, actually. So I think we'll go to questions now. That makes sense. So the first question that we got was from Joanna. And Joanna says, it's really interesting to hear Tabby's experience of multi-agency working using a strength-based agenda. I wonder how well other agencies responded to this. Could you give some pointers or questions to encourage a strength-focused approach to these meetings? So I'm going to direct the question to Tabby, but I'm sure that Tom and Eileen can contribute to that. So how did other agencies respond to a strength-based approach? And can you give some pointers to encourage a strength-focused approach?
Yeah, sure. Thanks for your question, Joanna. So I think in this case, initially sort of suggesting working in that way probably felt, I remember it kind of feeling a little bit ambitious, I guess, at the time to really suggest that, because we were all sort of in this mindset of like, what are we going to do? This is really, really challenging and there's so much going on. We just need to like respond to what's going on. But I think once we started working in that way, it kind of, we all sort of noticed actually the well-being of ourselves coming out of those meetings, maybe not feeling so heavy and so hopeless actually. And I think that what we were using was a strengths meeting toolkit that Golden Key actually sort of developed over the last couple of years. And so we had a resource that we could share, that I shared with everyone in the multi-agency team before, so that we can kind of like just, I guess, get used to thinking in that way. And really, the toolkit's actually available on Golden Key's website. And there's actually the sort of agenda there as well. But essentially, it's just sort of checking in with everyone initially, If the client's there, which in this case the client wasn't, but other meetings that I've chaired, there's clients have been there, we just sort of check in about the language being used. As Aileen was talking about, it's really important to just to make sure everyone understands, you know, acronyms or however we're going to speak about the problems or the issues. And then just going in really straight away and just talking about the strengths of the person and what's going well, really, and the skills and the qualities and the resources that they've got available to them, anything that is successful to them. And then kind of then maybe going on to some of the issues that are being faced and some more of the challenges. So yeah, I just have a look on the website, because there's a really great toolkit and resource there to kind of help meetings sort of draw out all those, being more strengths-based.
I've just shared the link to the Strength Meeting Toolkit in the chat for those who are interested. Tom?
Yeah, I mean, just to add to that really is that it's positioning yourself, isn't it, within those meetings, and you know, being curious with the kind of the tone and the language that's being used in those meetings, and then you know, being confident in appropriately challenging people through curiosity. So, you know, I wonder if that's the best way to explain what's happening for this individual. And I think it's really important to then bring the client's voice in there as well, and to ensure that, you know, their narrative, their story, you know, their world is included in those reflections or in those conversations. So where you can, try and bring the client's voice in, and just really check the language that's being used, and then just framing the discussions, which then links to the strength-based toolkit, which lends itself to some methods of doing that. You know, there's a whole agenda in there which you can use, but before you're going into these meetings, or if you're you know, having those conversations, just keeping it, you know, keeping that at the back of your mind, you know, is this the best way we can be talking about this individual? You know, asking the right questions to kind of ask others to think in a different way, setting the ground rules in the beginning, that kind of thing. But it's that mindset, it's that culture, and once you start practicing that, you become so conscious of when people are just stuck in a deficit way of talking. And culturally, you know, multi-agency meetings, you start off, so what's wrong with the individual, and you know, what have they done wrong, and you know, and just reframing things. I think it's the best approach.
Aileen, did you have any thoughts on that?
Yeah, just a couple of things. I think, you know, in these kind of meetings, what can often happen is that, you know, as I said, agencies retreat into their silos and become defensive. And particularly, you know, agencies can often feel that if they step forward, they're going to be left on their own with the client, with kind of managing that. So I think what the strengths-based approach really starts to build a different collaboration, not just between the person who's receiving services or should be receiving services and agencies, but across the agencies themselves. And I think it is about building that trust. So I think it starts to allow other opportunities. You know, Tabby mentioned the Creative Solutions Board, and you know, we've worked hard on the Creative Solutions Board for building those relationships through a strengths-based approach. And what was really, I felt that the kind of atmosphere in those rooms changed when people could, you know, also honestly say that agencies didn't know what to do. And actually that can really just allow some grounding of the issues, and create a space where a different approach can be found.
Thank you. So another question we've received is, how has the COVID pandemic impacted those 5 systemic challenges? That's a big question. Tom, do you want to start?
Well, I mean, it's had a massive impact, hasn't it, in so many different ways. It's actually been incredibly positive for a lot of clients with our response as a city, and in terms of just shifting a mindset and a culture and an approach. And if you look at a lack of appropriate options, you know, Golden Key were involved in the Everyone In scheme with the council, and were able to manage some emergency accommodation with the hotels, and that was a huge success. The reason why it's a huge success is because suddenly the people who weren't able to access housing and found the pathway re-traumatizing, or you know, wouldn't engage in kind of conventional pathways, suddenly had a very different experience, and it was much more trauma informed, much more psychologically informed, and yeah, we saw some amazing results as you know, through that response. Assessment and processes and thresholds, that all went out the window. We didn't have time to assess people and spend all this sort of time with bureaucracy and making these judgments and paperwork. People were just fast tracked straight in. So, you know, that meant that, you know, transitions were quicker, people were picked up. If someone was coming out of prison, they had a place to go straight away, you know, for example, this idea of shared accountability. So, you know, we all experienced it. Everyone was in, weren't they? It was like, this is a pandemic, right? How can we help each other, right? You know, I'm a manager, but actually I'm going to go out and help you deliver those meds to the clients and help you deliver the food and share that accountability and share that risk and, you know, really kind of reflect and problem solve and not be defensive and protective, but to work collaboratively and work together. And, you know, everything I just explained then led to a new culture, a new mindset, and it really shifted at every level. So, you know, operationally on the ground, you know, really kind of positive culture within the team. I think people who worked, Tabby actually worked in the hotel, should be able to tell you more, but, you know, there's a really good sense and there's a good feeling. You know, and then obviously people need to be looked after, so a sense of well-being and that culture around looking after staff and preventing burnout. That was really important. Aileen was a big player in that with Second Step, you know, really looking after everyone in the organization and making sure people were taking that hour through the day. Things like this sort of cropped up in this new culture of well-being and looking after each other. But then obviously the culture kind of worked all the way through, even to strategic, and then commissioning changed. So, you know, we've seen a continuation in this provision. So yeah, lots of positives there from COVID.
Aileen or Tabby, do you have any thoughts on how the pandemic has impacted those challenges?
Yeah, so as Tom said, you know, the Arnos Manor response, and I think there are some reports on our website, or there will be shortly on the Golden Key website, about what we learned through that from some peer research that we did, and also some staff learning from that, which is fantastic. And as Tom rightly said, it's like the agencies pivoted to do something different. So agencies wasn't clinic-based or office-based, it was get out and see people. Which was so important. And I was at a meeting the other day when the Homeless Health Service was talking about how fantastic in Arnos Manor that the healthcare provider Sirona was able to be there and to look after people's physical health needs as well as a whole range of other needs. Unfortunately, that provision is now closed, and so the challenge is, how do we recreate that provision where that is that multi-agency wraparound support to people who are homeless? You know, how can we do that? But also, I also have heard that one of the other things that happened was that actually, as agencies, there was a fantastic community response. So a number of chefs came together to do some meals response, and also lots of volunteers did that response. So I think sometimes as agencies, we forget that there is a community there's a whole range of community resources out there that we can really build on, and the pandemic reminded us of that. You know, we've had such fantastic community response anywhere across the board around the pandemic, but particularly around Arnos Manor and those people with complex needs. The community really stepped up and helped us And I think we've got to make sure that we remember that and build those relationships, and we don't step back from those relationships, which possibly is happening at the moment. So that's one of the things that we've got to do as agencies, is to think about how we build those community resources into any of our service responses.
Tabby, did you have any thoughts?
Yes, just to add that I think during that time we really saw agencies across Bristol going above and beyond what they were commissioned to do or within their remit, and despite that potentially on a long-term basis not being sustainable, and there being a huge amount of impact around people's capacity to continue working in that sort of crisis response way, we did see services working very differently, and I think that has just kind of shifted a bit of a mindset around the possibility of working in new and creative ways. So yeah, I would just agree that us knowing that we can do that when necessary, and hopefully that can sort of push a bit of system change in that direction. Yeah.
Sarah Jane, can I add something else?
Absolutely.
Yeah. Yeah, what I was, and kind of Tom kind of mentioned this, is about, what we have to do is develop an enabling culture that enables teams and staff and managers to be able to explore and really enable people to find new solutions. I think sometimes we can get bogged down in bureaucracy and processes and procedures, and those things can dominate the service response rather than the right response to the individual. And what we saw in COVID, as Tom said, is what some of those processes highlighted, they weren't necessary. And I think the challenge is how to resist going back to the old ways of working. How do we retain those new ways of working? And part of it is what we learned is, you've got to have obviously good assurance and good governance around services, but you've also got to enable teams and staff to be able to be in that creative space within the kind of boundaries of the service that they can deliver, and to be, look for new solutions. Yeah.
Thank you, all of you. I can't believe I'm saying this, but we've got 5 minutes left. So I'm going to pass the word back to Tom, who's going to wrap up and introduce actually the next webinar, which is taking place on the 19th of May at the same time.
Yeah, so our next webinar will be based on one of our learning products or tools that we call the 3 pillars. And through our reflections today, what we've heard a lot of is the term relationships and collaboration, and this idea of creating these learning spaces and really embedding our learning. So we've sort of talked about really observing the problems, admiring the problems, talking in deficit ways, and sort of moving away from that. The 5 thematic challenges here are a way of kind of maybe focusing more of our kind of inquiry into that. So it's a map of what's happening in the system. If we can focus around these challenges in any given context, and then sort of be curious around what this means to us and our context, then it gives us a focus within a very complex system. So the next, moving on from that, is then, well, how do we do that? If we've got the focus and we know where we're kind of looking at that leverage point within the system, what can we use to sort of make sense of that complexity? What can we use to support each other, to inquire, and really move forward with hopefully enabling change? So the next webinar is really about that, and we talk about relationships, we talk about collaboration, and we talk about reflection, and how useful that is in working with each other to affect change and improve the lives of people facing multiple disadvantage.
Thank you, Tom. So yes, we've reached the end of this webinar, which has been brilliant. It's been really nice to hear your reflections and your experience. And thank you, everyone. Thank you to our lovely panelists, but also thank you to everyone who attended today. As I said, I will share the recording of the webinar with you, and it will be available on our website as well. So do feel free to share it with your colleagues. You know, the whole purpose of our webinars is to share our learning and make sure that those 8 years have mattered and left a bit of a legacy. So yes, please feel free to share. If you have any more questions, please feel free to send them to us. You can send them to info@goldenkeybristol.org.uk, and we'll be more than happy to answer them for you. So yes, have a lovely day, everyone. Thank you.
Thanks.
Bye. Bye.
Thank you.
Bye.
Bye.